First aid for burns. What are burns? Burns are one of the most common household injuries, especially among children. The term burn means more than the burning sensation associated with the injury. Burns are characterized by severe skin damage that causes the affected skin cells to die. Most people can recover from burns without serious health consequences depending on the cause and degree of injury. More serious burns require immediate emergency medical care to prevent complications and death. The first step in treating a burn injury is determining whether the burn is a first degree, second degree, or third degree. That determination will direct action and treatment. Thermal burns treatment. Call an ambulance and activate emergency response team if the burn penetrates all layers of the skin is leathery or charred looking with white, brown, or black patches, the person is an infant or a senior. Things not to do. Don't contaminate the burn with potential germs by breathing or coughing on it. Don't apply any medical or home remedy including ointment, butter, ice, spray, or cream. Don't give the burned person anything to ingest. Don't put a pillow under their head if you think they have an airway burn. For all burns, stop burning immediately. Put out fire or stop the person's contact with hot liquid, steam, or other material. Make sure you and the person who's burned are safe and out of harm's way. Move them away from the source of the burn. If it's an electrical burn, turn off the power source before touching them. Check to see if they're breathing. If needed, start rescue breathing if you've been trained. Help the person stop, drop, and roll to smother the flames. Remove smoldering material from the person. Remove hot or burned clothing. If clothing sticks to skin, cut or tear around it. Remove constrictive clothing immediately. Take off jewelry, belts, and tight clothing. Burns can swell quickly. Then take the following steps. For first degree burns, which usually affect the top layer of the skin, cool the burn. Hold the burned skin under cool running water or immerse in cool water until the pain subsides. Make sure that the water is not too cold or don't use ice. Use compresses if running water isn't available. Protect burn. Cover with sterile, non-adhesive bandage or clean cloth. Do not apply butter, oil, lotions or creams, especially if they contain fragrance. Apply a petroleum-based ointment 2 or 3 times per day. Treat the pain. Give over-the-counter pain relievers such as acetaminophen, ibuprofen or naproxen. When to see a doctor. Seek medical help if you see signs of infection like increased pain, redness, swelling, fever or oozing. The person needs tetanus or booster shot depending on date of last injection. Tetanus booster should be given every 10 years. The burn blister is larger if the blister is larger than 2 inches or oozes. Redness and pain last more than a few hours. The pain gets worse. The hands, feet, face or genitals are burnt. Follow up. The doctor will examine the burn and may prescribe antibiotics and pain medication. For second degree burns, which usually affects top 2 layers of the skin, cool the burn. Immerse in cold water for 10 or 15 minutes. Use compresses if running water isn't available. Don't apply ice. It can lower the body temperature and cause further pain and damage. Don't break blisters or apply butter or ointments, which can cause infection. Protect the burn. Cover loosely with sterile, non-sticky bandage and secure in place with gauze or tape. Prevent shock. Unless a person has a head, neck or leg injury or it would cause discomfort, lay the person flat, elevate feet about 12 inches, elevate burn area above heart level if possible, cover the person with coat or blanket. See a doctor. The doctor can test a burn severity, prescribe antibiotics and pain medications, and administer a tetanus shot if needed. For third degree burns, first immediately call an ambulance and activate emergency response team. Protect the burn area. Cover loosely with sterile, non-stick bandages or for large areas, a sheet or other material that won't leave lint in wound. Separate burned toes and fingers with dry, sterile dressings. Do not soak, burn in water or apply ointments or butter which can cause infection. Prevent shock. Unless the person has a head, neck or leg injury or it would cause discomfort, lay the person flat, elevate feet about 12 inches, elevate burn area above heart level if possible. Cover the person with coat or blanket. For an airway burn, do not place pillow under the person's head when the person is lying down. This can close the airway. Have a person with facial burn sit up. Check pulse and breathing to monitor for shock until emergency help arrives. See a doctor. Doctors will give oxygen and fluid if needed and treat the burn. Thank you.